Well, welcome back. In our Family First segment this morning, we're talking about ways to protect your family from infection. Amber Delafave joins us now with some tips. And first of all, thanks for joining us this morning.
Thanks for having me.
Let's talk about the latest study that shows people who wear eyeglasses are less likely to contract COVID-19. What can you tell us about that?
Right, so that was a very small study, but the premise is very interesting. These reports are always very interesting to read. But if you think about it logically, CDC guidance does say that, eye protection is recommended as PPE or personal protective eyewear to prevent COVID. So it bears to reason that if you have glasses in front of your eyes, that would protect your eye mucous membranes from any splash or splatter that could contaminate your eyes and infect you. Furthermore, it also acts as a reminder to people to not touch their eyes, as we know that touching surfaces and then touching the eye can cause infection at times. It acts as a reminder to keep us from touching our eyes, just same way the face mask keeps us from touching our nose and our mouth.
So it's not just COVID then, it could be any other virus as well,
Correct.
Right?
Correct.
So should we buy glasses for everybody in the family, perhaps?
I don't think we need to go that far just yet. If everyone is wearing masks appropriately as they should be, there shouldn't be a bunch of aerosols flying around in the first place that we need to worry about our eyes. But certainly if someone is very concerned and feels uncomfortable and feels like there's a lot blowing around, it's not going to hurt to put some glasses on.
Okay, so we've been talking about COVID for about a year now. We've learned a lot about it. What can you tell us about protecting your home from disease? Should we leave our shoes in the garage?
I'm a big advocate for leaving shoes in the garage, especially if you have children. For adults, it's not so much of a concern. It's the furthest away from our faces. We're usually not touching our shoes and then touch our face. The under part of the shoe can be highly contaminated with not just viruses, but bacteria and fungus. And if you obviously wear them into your home, you could be contaminating the floors of your home. So it is best, I think it is a good practice to leave your shoes in the garage or outside of your home. Healthcare workers do this traditionally. They don't even wear their shoes home, and that's because there is a possibility for contamination and bringing that into your home. And if you have children crawling around, you don't want that.
I'm showing this to my kids because I have a sign on the door in the garage saying leave your shoes out here, and they just go right past it. So thank you so much for that. Real quick, how often should we disinfect, and where are the dirtiest surfaces in our home?
Right, so we call these high-touch surfaces. So these are surfaces that you're touching frequently, doorknobs, refrigerator handles, countertops, sinks, any horizontal surface where anything could settle and sit on there. Viruses tend to like very smooth, non-porous surfaces, so glass, and as I said, countertops, things like that. You want to clean them pretty frequently. Some things that people don't think about as often is their cell phone or the remote. We obviously handle those very frequently, and always check manufacturer instructions on how to clean and disinfect. Usually it's best an alcohol-based product for electronics. But you should be cleaning those high surface areas very frequently, especially if someone in the home is sick.
All right. Amber, thank you so much. We appreciate it.
Absolutely. Thanks for having me.
And if you missed any of this conversation, we'll have it posted for you on our website, rochesterfirst.com.